Hello, and let me welcome you to the patient education class for those patients having their hip or knee surgeries at the Everett Road, the 123 Everett Road Surgery Center. The objectives for today are to be sure that you are prepared for your upcoming surgery, know what to expect on the day of surgery, understand how to transition to home as easily as possible, as well as some of the common experiences that our former patients have experienced after their surgery. We have a pretty robust team at OrthoNY. Our case management team is led by Dawn Allen, who is the supervisor. You may have been contacted by one of the case management team members, including Mary Beth, Megan, Jody, Angie, Kelly, and in addition to, and not pictured in this video, is Kelly Matthews. OrthoNY believes that when a patient is prepared for their upcoming surgery, they have far superior results with that surgery. So you have taken the first step by participating in this video to becoming better prepared for your surgery. The guidebook should have been mailed to you by the case management department and will be a resource for you to help guide you through the process of the outpatient joint replacement. It will cover both preoperative, getting ready for surgery, as well as postoperative care instructions, and is a tremendous reference to help guide patients throughout the process. The following checklist is located in the appendix section in the back of your guidebook. Please use it to help guide you throughout your time for getting prepared for surgery. In the 2 to 4 week section, you will note this includes beginning pre-surgery exercises, getting your home prepared, quitting smoking, stopping drinking, in addition to getting any vaccinations that are necessary, flu shots, boosters, at least a couple weeks before surgery, and obtaining necessary equipment. In the 1 to 2 week before surgery, we ask that you begin to stop shaving below the neck, as well as avoiding yard work, which could cause cuts and scrapes to your skin, as this then provides an open area for potential infection issues in the future. As well as be sure that you attend your pre-surgery physical therapy appointment. Beginning 5 days before your surgery, you're going to begin logging and utilizing the mupirocin, as well as picking up any medications that you're going to need for your surgery from your pharmacy. This might include aspirin, extra strength Tylenol, as well as a stool softener or Colace. As you can see on day 3 before your surgery, this is the day you will begin utilizing the CHG soap to do your showering. And again, you can track that in your guidebook as well in Appendix D. 2 days before surgery, you're going to continue with the mupirocin and as well as the showering with the CHG. And be sure that you have picked up any prescriptions that your surgeon has called into the pharmacy for you. The day before surgery, you'll get a call from the surgery center in the afternoon, and they will advise you what time you need to arrive on your scheduled day at the surgery center. We also ask that you change the bed linens on your bed that day before surgery, so that on the evening you will shower utilizing the CHG soap, dress yourself in freshly laundered undergarments and bedclothes, and get into a clean, freshly made bed to ensure that we're not contaminating the skin as little as possible. It's encouraged for you to hydrate on the day leading up to your surgery, and this allows you to drink clear liquids up until 2 hours before your scheduled arrival time at the surgery center. we do encourage people to drink an 8-ounce bottle of Gatorade 2 to 3 hours before your scheduled arrival time at the surgery center. Take any medications that the doctor has said you need to take on the morning of surgery. Do your final shower before reporting to the surgery center, and bring the guidebook if to use as a reference. It's recommended that all patients undergoing a joint replacement surgery have a coach or caregiver that are going to help guide them through the process. This coach provides comfort and motivation, and really provides that support for the patient at the time of discharge and while in the home. Prior to your surgery, you will need to receive clearance from your primary medical doctor, in addition to any specialists that you might see, including your cardiologist, pulmonologist, endocrinologist. These appointments need to be completed within 30 days of your surgery date. We ask that you try to get them done as soon as possible, preferably 21 to 30 days prior to your surgery. In addition to your clearance appointments, you may also undergo pre-surgical testing, blood, urine, EKG, chest x-rays. You'll need to attend a joint education class, which you're doing at this point in time. You'll need to attend a physical therapy appointment for pre-surgical education, and this will be set up at OrthoNY, at one of the OrthoNY PT locations. Please call the number that you see there, 518-557-2228, to get yourself scheduled, as well as the pre-surgical nurse will call you from the surgery center to go over all the necessary information. All patients, regardless of their vaccination status, will likely need to undergo a COVID test, and this is typically performed 3 to 5 days prior to surgery. Patients undergoing hip and knee replacement surgery typically require a 2-wheeled walker for immediate post-op care. Pictured in the slide in the middle is the 2-wheeled front-wheeled walker. Some patients may be able to use crutches if they've had prior experience and are very coordinated. However, most patients do best with a 2-wheeled walker. The 4-wheeled rollator walker is not recommended for immediate post-op mobility. Patients will likely be able to progress from the 2-wheeled walker to a straight cane within a few weeks of their surgery, and then eventually be able to transition to ambulating without a device. As discussed earlier when reviewing the pre-checklist, you'll need to attend a pre-physical therapy appointment. Please remember to call the number that was outlined to schedule for a pre-physical therapy appointment at one of the 3 OrthoNY outpatient clinics. It is best to bring your walker and cane to that appointment, as the therapist will teach walking and stair climbing activities using the device that you will be using after surgery. This is also an opportunity for the therapist to adjust the equipment to fit you properly. The therapist will also teach and recommend ways to get in and out of your car easier after surgery, as well as an exercise program for you to perform before and after surgery. If you do have any precautions after surgery, the therapist will also provide education regarding those. The surgeons ask that you schedule your outpatient physical therapy prior to your surgery so there is no delay in getting started. For all total knee replacements, it's recommended that you begin your outpatient physical therapy 2 to 3 days after your surgery. For total hip replacements, most of the surgeons express to their patients that it is optional. Patients can can go for outpatient physical therapy, but they don't always have to. If you would like to begin physical therapy after your total hip replacement, it's recommended to start 2 to 5 days after your surgery. If you are going home after a hip replacement and do not plan to go to formal physical therapy, we ask that you be committed to a progressive walking program where you are going to walk further and further each day, challenging yourself. Most of the patients are able to get back to walking a half a mile or greater within the first 2 weeks after their surgery. Pictured are some of the commonly used equipment that patients find helpful after hip or knee surgery. This includes reachers, grabbers, sock aids, shoe horns, raised toilet seats, toileting aids, tub transfer benches, chairs, and leg lifters. None of them are required for surgery. However, they can help assist you after surgery from having to do and making it easier overall for you to perform your everyday activities. Preparing your home before going in for surgery will make it a lot easier for your recovery from your home. This includes having a chair that has armrests on it. It is a lot easier to get up and down from a chair with armrests on it. Reclining chairs work great. You will not need any special bed. No hospital beds are required. We do ask that you remove or secure throw rugs throughout your home, paying special attention to those thresholds where rugs can very easily roll up while you're pushing your rolling walker after surgery. You might want to prepare ahead of time with some frozen meals in the freezer, as well as arrange for someone to help assist and care for your pets. The surgeons take great steps to preventing infection after total joint replacements. Two of these steps include the use of CHG soap, which you will use during your showers prior to surgery. This is a series of 4 showers over 3 days prior to surgery. So you begin 2 days before surgery, 1 day before surgery, the evening before surgery, and the morning of surgery. The CHG can be purchased, either 2 or 4% CHG. Most all of the local pharmacies have this. You can also get it online. Mupirocin will have been called in to your pharmacy by your surgeon. This is applied to both nostrils beginning 5 days before surgery. You'll do this twice a day, morning and night. You do not need to apply any mupirocin on the morning of surgery. We ask that you stop all alcohol and other drugs 2 weeks prior to surgery. Research shows that stopping the use of alcohol and illegal drugs helps to improve your ability to heal and decrease some of the potential complications that can occur. With regards to smoking, it is strongly recommended that you stop smoking at least 4 weeks before surgery. We really recommend closer to 6 weeks. Research shows that when one is smoking, their risk of infection is significantly greater, as well as other medical complications, including heart attacks, pneumonia, UTIs, blood infections, and blood clots. All patients will need to take antibiotics when going to the dentist or having other surgical procedures performed. The physician's assistant will speak with you at your follow-up visit with regards to future dental work. Antibiotics will be called into your pharmacy for you and should be taken prior to dental work being performed and other surgical procedures performed. We do ask that you refrain from dental work being performed within the 3 to 6 months after your surgery. Your surgeon will call your post-operative medications into the pharmacy 1 to 2 weeks before your surgery. Please pick up your meds before coming in on the day of surgery. We do ask that you do not take any of the post-operative meds during the pre-operative period. In addition, you will need to pick up some over-the-counter medications, including extra-strength Tylenol, Colace or stool softener, and baby aspirin if that's what your surgeon is going to be using as a blood thinner. Here's the fasting guidelines prior to surgery. We ask that you not eat after midnight on the evening prior to your surgery. We do, however, encourage you to drink and remain as hydrated as possible prior to surgery. This includes the ability to drink clear liquids up until 2 hours before your scheduled arrival time at the surgery center. In addition, it is recommended for you to drink an 8-ounce bottle of Gatorade, flavor of your choice, 2 to 3 hours before your scheduled arrival time. In addition, we ask that you do not smoke 24 hours prior to your surgery. This slide reviews some important things to bring with you on the morning of surgery. Please be sure to have eyeglasses and hearing aids so that all of the preoperative instructions and consent forms can be signed and received appropriately. If you utilize a CPAP machine, please bring it with you, as well as any insulin pump supplies. Please bring the walker with you that you will be using so that you can use it after your surgery. In addition, a cell phone and an extra pair of underwear. Some other important papers items include a list of your current medications, your driver's license or an ID, insurance cards, advance directives, and a credit card. Then in the next series of slides, we'll review what to expect on the day of surgery. This slide reviews the visitor policy during your day at the surgery center. Depending upon the COVID numbers, you may or may not be allowed to have a family member present at the surgery center. If a family member is not allowed to be in the surgery center, the surgeon will call and speak to the family member once the surgery is complete. And if so, one family member would be allowed to come up to the reception area at the time of discharge to receive all of the discharge information. This schedule provides a sample of what your day will look like at the surgery center. You'll arrive at your scheduled arrival time. The nursing team will get you ready for your surgery. You'll be brought into the operating room and the surgery will be performed. At the conclusion of the surgery, you'll be transferred out to the recovery area. Throughout this entire process, nurses will be monitoring your vitals and your overall being. They'll be continuously giving you IV hydration and IV antibiotics. They'll be monitoring to getting you back to voiding and ambulating, at which time you will be able to discharge. Discharge instructions will be reviewed with you and your caregiver, and you will be safely able to discharge to home with an average of around 5 to 6 hours from your scheduled surgery time. The surgery center is committed to providing your joint replacement surgery and minimizing your risk for infection. As a result, the team will perform an additional CHG wipe down, site-specific, meaning the limb that you're having surgery on, they will wipe down with a CHG towelette. You may also have a finger stick performed to get a current reading of your blood sugar level, even if you are not a diabetic. And IV antibiotics will be started just prior to surgery. While waiting for your surgery, members of the surgical team will come and meet with you, including your surgeon, the anesthesiologist, and team members. At this time, they will identify you as the patient They will identify the leg that surgery is going to be performed on. They usually put some sort of a marking on that leg so that when surgery begins, they're able to verify that they're doing the correct procedure on the correct joint. Spinal anesthesia is typically performed with hip and knee replacement surgeries. As you can see in this slide, 90% of all total joint replacement procedures are performed using spinal anesthesia. General anesthesia may be required depending upon certain medical conditions. The anesthesia team will discuss with you prior to your surgery which type of anesthesia they recommend. What to expect in the recovery area. You will gradually be awakening from the anesthesia. The nurses will be monitoring you closely. They'll be monitoring your pain control. Most patients need 1 to 2 hours of post-operative recovery before they're able to go home. Immediately after your surgery, you're at an increased risk for falls. We ask that you please utilize the call button and ask for help if you do need to get up. Please do not get up by yourself. The next few slides will be reviewing discharge and transition to home. We would like to partner with you on your pain management. We understand that joint replacement surgery does hurt. Overall, our goal is to keep your pain at a 6 or less. Utilizing the pain medication pyramid as a guide will help to keep your pain managed and under control. Using ice, elevation, and getting up and moving around regularly also assists with managing your pain. Please be sure to let the case management team as well as the nurse know your current levels of pain. This medication pyramid is located in your guidebook. Please use it as a reference. Some medications in this pyramid may not be prescribed in all cases. Please use the meds that have been prescribed in your circumstance. The bottom row medications located in the green color are the around-the-clock type medications. This includes Celebrex, which is an anti-inflammatory medicine and is taken twice a day, every morning and every night. Sometimes a surgeon may order a different anti-inflammatory medication. Pain medication-wise, the surgeons recommend that you are utilizing Tylenol, 500 milligrams, which is extra strength Tylenol, and taking 2 tablets every 6 hours. When it comes to blood thinners, all patients are placed on some sort of a blood thinner after surgery. Most patients who have not been on previous blood thinners will take a baby aspirin every morning and every night. If you were previously taking Eliquis or Xarelto or some of the other blood thinners, your surgeon will likely restart those meds on the evening after your surgery. In addition, we recommend taking a stool softener every morning and every night. Those medications in green are to be taken pretty much around the clock every day. If your pain is controlled taking these medications, you do not need to take any of the other medications. But if your pain is not controlled or not controlled well, and you need to take additional medications, the next line that we recommend is to utilize the tramadol if it was prescribed. If the tramadol was prescribed in your case, you can take 1 tramadol with your 2 Tylenol every 6 hours. These medications work very well together and multiply the effects. If your pain is controlled taking a tramadol with your 2 Tylenol every 6 hours, then there is no need to go any further. If your pain is not controlled well, then you can take an oxycodone in between your every 6-hour doses of Tylenol or Tylenol and tramadol to treat the breakthrough pain. The goal would be that you do not need to take oxycodone every 6 hours. Rather, it's recommended to use it to treat breakthrough pain and maybe only from time to time. When elevating your leg, it's important to get your ankle 12 to 16 inches higher than your heart with your leg as straight as possible. Picture a garden hose running up the back of your leg. This is similar to the vessels in our leg, and if we were to elevate with our knee in a bent position, it would kink those vessels similar to kinking a garden hose. This slide provides a recipe to create your own home ice packs utilizing rubbing alcohol and water. The mixture creates a nice slushy mix which will mold around your hip or knee. I practice this in my own home. I have teenage daughters who are frequently injuring themselves on the sports fields, and this has come in handy numerous times. I do recommend that you keep the ice pack in the freezer in a pillowcase. And the reason for that is it is a lot easier to transport it from the freezer to the couch or sofa where you're going to lay down and elevate and ice your leg by wrapping the pillowcase around the handle of your walker. It's a lot easier than trying to walk, pushing a walker while holding an ice pack. As previously presented, please remember to schedule your outpatient physical therapy 2 to 3 days after your surgery. This should be scheduled prior to coming to the surgery center on the morning of surgery. Hip replacements, again, it is optional, and if not performing formal physical therapy, please be committed to performing a home program, including a progressive walking program. This slide reviews a few postoperative complications. Blood clots is one thing that we are looking to prevent. Getting up, moving around, exercising, and taking your prescribed anticoagulant, whether that is aspirin or Coumadin or Xarelto or Eliquis, are the key ways to preventing blood clots from occurring. Constipation is another common postoperative complication. Taking the pain medications has a tendency to bind people up. We strongly recommend that you increase your hydration before and in the days after surgery. Take stool softeners regularly, as well as increase the fiber in your diet, or begin eating foods that you know have a tendency to go through you in those first few days after surgery. The case management team will make a series of calls to you before surgery and within the few weeks after your surgery to be sure that all is going well. Please give them a call if you have any complications that arise so that they can help you as soon as possible. The next few slides will review some common experiences after surgery. This slide shows a pretty large amount of bruising that tends to occur on the back of the leg in the days following surgery. We see this most commonly 2 to 4 days after surgery, and it's typically the caregiver that identifies it as the patient is walking away from the caregiver within that time frame. It's normal, it's to be expected, it's not something that has to be evaluated we do expect that you'll have a pretty significant amount of bruising and swelling. This slide demonstrates a couple different bandages that are utilized after surgery. The bandage on the left is an Aquacel dressing. The Aquacel dressing is able to hold a lot of blood and content. The amount of spotting that you see in this picture is actually a small amount of spotting that you may have after surgery. Please inform the case management team if the dressing were to leak through or out the side. These two pictures demonstrate dressings that did need to be changed. If you can see, the dressing on the left would have been okay had it not been for the leaking out of the top outside portion of the leg. The dressing on the right side was leaking at the bottom of the dressing. Both these dressings needed to be changed in the office by the surgical team. Please contact the case manager if your dressing needs to be changed. As we all know, taking pain medications can impair your ability to drive. Your doctor asks you to refrain from driving for the first 2 to 3 weeks after your surgery. At your post-operative follow-up visit, you can discuss with the surgeon and the PA your ability to drive. Sleeping after a joint replacement surgery can be one of the more challenging events. Some people experience difficulty sleeping for the first couple months. Sleeping with a pillow between your legs and or feet, sometimes sleeping in a recliner, may help during these struggles. Some patients experience a decreased appetite and or feeling down in those first few weeks after surgery. Please continue to try to hydrate as well as eat a diet that is high in protein to assist with your healing. This slide reviews some of the common reasons why you would call your surgeon or case manager. While it is normal for the leg to swell and feel heavy during the first 10 days after surgery, observe it for redness, swelling, and increased pain in the wound. Any pus coming from the wound should be reported, as well as a temperature over 102 degrees. It is normal to have a low-grade fever after surgery. This is one of the reasons that we recommend taking Tylenol regularly. If you were to have a foul smell coming from the wound or dressing, or an opening of the wound, please contact the case manager and or surgeon. If you were to have painful or worsening swelling in your leg or calf, or if you were to develop a rash, please as well give the case manager or surgeon a call. If you have questions regarding the integrity and or the amount of drainage in your dressing, please contact your case manager. They may ask to have you take a picture of the dressing so that it can be shared with the surgeon and the surgeon's team. Please also inquire if you have questions regarding your medications. We thank you for choosing to have your surgery at OrthoNY York's Surgery Center. Again, your case management team will continue to follow you before and after your surgery. And if you did have any questions, please express those questions to the case management team.